Today we've got Dr. Raphaela Itzikowitz, and she's a specialist pediatrician. She specializes in general and neurodevelopment practice, and she provides assessments and action maps for the neurocurious. So welcome today. We're so happy to have you with us.
Thank you so much, Kat. Thanks for having me.
Sure. Do you want to maybe start with giving us a bit of a brief introduction?
Sure. So my name is Dr. Raphaela Itzikowitz. I'm a specialist pediatrician based in Cape Town, and I have a special interest in neurodevelopment. I spend my days working with babies and children and teenagers, really from newborn feeding struggles to ADHD, autism, anxiety, acute illnesses, learning challenges, the whole realm of peds-related illnesses and diseases. But I'm also a mom, and that lens, I think, changes everything. I have 3 of my own little children. I understand 2 a.m. Googling, the quiet comparisons, those hard questions, is this normal, the 3 a.m. spiral. And I think my work sits at the intersection of medicine, development, behavior, and family systems. And I'm deeply passionate about helping children in the context of their families thrive, grow, be the best that they can be, keep healthy, not just the absence of illness and surviving.
Absolutely. So tell us a bit more about your neurodevelopment specialization and focus.
So when I finished specializing as a pediatrician, I worked for 6 years in the neurodevelopmental department at Red Cross Children's Hospital under the most incredible mentor, head of Department of Neurodevelopment, Dr. Professor Kirsty Donald. I taught at UCT, and I've worked at a couple of the Elson schools within the Cape Metropole. And neurodevelopment really looks at how the brain grows and connects and regulates over time. So I assess and support children with undifferentiated behavioral things. Parents come to me when life just feels like it's a little bit too hard, and they get the sense it's something maybe underneath the behaviors, and that may involve or include things like ADHD, autism, learning disorders, anxiety, emotional dysregulation difficulties, sleep difficulties, developmental delays, and children who have chronic and ongoing illnesses, who spend a lot of time in hospital and maybe a little bit behind their peers because of complex medical conditions, and anything really from neurological conditions to cerebral palsy, which may pose challenges for the normal growth and development of children.
That makes so much sense. So can you maybe talk to us a bit more about that in terms of statistics in South Africa, maybe kids with neurodivergence? I'm sure it's a little bit difficult because a lot are probably undiagnosed.
That's exactly right. And I think as awareness is increasing, and we're starting to understand that the child that we used to call the naughty child or the angry child is not actually a bad child or a naughty or angry child, that there's a lot of neurodiversity within the normal population, and we have to understand what's behind those behaviors in order to be able to support these children appropriately. In South Africa, the rates of ADHD are between 5 and 7%. Autism spectrum disorder affects 1 in 100 children in South Africa, and in parts of the USA, that's as high as like 1 in 36. So the incidence is quite variable across the world, and I think that is to do with education, awareness, and rates of formal diagnoses. Learning disorders are also really common, and they affect about 10% of children. In South Africa, as you said, we really likely underdiagnose children significantly, and these are due to access barriers, stigma, there's a limit of specialist services, and girls especially are underdiagnosed because they present differently and often have socially acceptable behaviors where they mask or they are able to function and cope better, and so we often misdiagnose these in girls.
Absolutely. Okay, are there any illnesses that are coming up in winter especially that we can safeguard against, and what do you do with your own kids, for instance?
So I think the good news about coming out of summer is that hopefully the horrible gastro or stomach flus will be over. But when we run into the winter seasons, because we're more indoors, we don't play outside, the weather's not so nice, and some viral epidemiology is seasonal, we certainly run into more of the respiratory viruses. And the biggest one is RSV, which causes bronchiolitis in the little babies. We had a very nasty RSV season last year. have asthma flares because of viral induced kind of hyperreactivity of the airways. And the big one is always influenza. So those are the things to look out for. Now already we're seeing enterovirus and rhinovirus rates are very high, and those are the normal kind of cold or flu-like illnesses which cause congestion, snotty noses, fevers, coughs, and cold. What do I do with my children? You know, everybody always thinks that medicine is so complicated, and certainly it is in some aspects, but really it's just the simple everyday things that we do usually, and maybe we could just be a little bit more aware of during the winter months to prevent spreading and, outbreaks of these common colds and viruses. So most importantly, I would think is good nutrition, good sleep. Make sure that your children are immunized, that their routine immunizations are up to date, hand washing, and just general health hygiene that we were also very good at during the COVID pandemic, which is just, covering your mouth when you cough and sneeze, washing your hands with soap, keeping your children at home if they have raging fevers or, snotty and coughing all over the place. And because those viruses circulating in our communities. And then obviously now we have an RSV vaccine available in South Africa, and also the annual flu vaccine. So those are, I vaccinate my children every year with the flu vaccine. And children need 2 doses of the flu vaccine. It's widely available. Most of your pharmacies will have it. I have it in my rooms. Yeah, it's certainly helpful. If it doesn't prevent illness, it certainly reduces the severity and duration of illness.
Yes.
The main effect is to prevent hospitalization and severe forms of influenza. So yeah, I would say just stick to the basics and then make sure your vaccinations are up to date, and just be conscious and aware of how viruses spread. And remember, it will come back to, it always comes back. So
yes,
just to try
exactly. I think a lot of people forget basic things like hand washing, and yet it's such a vital, it should be a vital part of safeguarding.
Absolutely.
Okay, what are the biggest misconceptions when it comes to a child's development, in your opinion?
Sure. I think the biggest misconception is that development and growth is linear, that it always goes in a straight line. There's an old adage to say growth is messy, and as long as the trajectory is upward and that we are not losing skills, but we are acquiring skills steadily in an organized way. Sometimes it may feel disorganized. As long as we're heading in the right direction, that is growth and that is development. It bursts, it plateaus, it leaps. Sometimes it slows down a little bit. And another misconception is that behavior equals bad parenting, or that behavior equals character of the child. A dysregulated child is not a badly behaved child. A child who's throwing a tantrum is not a function of poor parenting. And another really important thing is this comparison culture that we have. Milestones have ranges, and we don't say that children must sit at 6 months and walk at 12 months. There's a 3 to 6 month range where we know children acquire certain skills, and I think as long as we are flexible within those ranges, understanding that everybody grows and develops at their own rate, I think we would have a better and much more relaxed and comprehensive understanding of what development is.
Absolutely. In your opinion, what 3 areas are peds the most helpful with?
So we are lucky in South Africa, and we have very great trained healthcare professionals. And our GPs are brilliant, and part of general practice is identifying and treating common childhood illnesses. But I think a pediatrician especially is most helpful in the early detection of specific child-related developmental differences, or knowing when that cough and cold is a little bit more than a cough and cold, because we have 4 to 6 years of extra training in child-specific illnesses and child physiology, which is quite different to adult physiology. Also just containment and guiding parents through illnesses with clarity and calm. And because we have that understanding of childhood trajectory right from birth up until 13, 14, 15, 16, we are often able to put that in perspective. And I think for me, most importantly, is helping families understand the why behind the need for an asthma pump, or a course of prednisolone, or an intervention by an occupational therapist, or the need for hospitalization in acute cases. So I think there is a huge role for education and, information sharing, and I think a pediatrician is really well placed to do those things.
Absolutely.
Not simply about treating disease, really. It's about translating the child and helping families understand their own children in sickness, disease, development.
I can't imagine not having had my ped. I mean, there's certain critical points in Ella's development and they're the only person that would know your child in that sense. And so they're a critical cornerstone. Okay, so what does a healthy immune system look like, and how can we help our children build one?
So there's a lot of research going on about immunity. I think for the general parent, for mums and dads everywhere, if your child is happy, thriving, growing, and has the absence of acute disease, I think your child, by all counts, has a healthy and strong, robust immune system. Yeah. Viral illnesses are a normal part of childhood. We call it nursery school syndrome, especially in those first couple of years when your children start going to school and it feels like they have coughs or colds or gastros or snotty noses every second week. We have to remember that viral illnesses can occur about 6 to 10 times a year, even in a healthy child with a robust immune system. And this is necessary for priming our children's immune systems, exposing them to various viruses and allergens and, dirt and dust, so that we call it the hygiene hypothesis. And we need exposure to viruses and dirt and antigens in the environment to prime our immune system to fight off more serious disease. So yes. Even a healthy child gets sick, they recover, they learn, they grow. And just to remember that mild viral infections are a part of immune priming. How we can support it. Sorry, Cass, you go.
No, it's fine.
Yeah. Again, supporting immunity is really some of the things that we discussed previously, and just there is no miracle immune booster. Just regulation and basics win. And I know what everybody is asking about is zinc at the moment, because we were, kind of common practice to use zinc as a multivitamin and as an immune booster. And remember that there's no evidence that zinc in and of itself is immune boosting or immune protective in healthy children. The only evidence for zinc is in acute gastroenteritis in children less than 5 years old, and in children with pneumonia in immune deficiency. And that sometimes helps with cell repair and shortens the duration of illness. But in a general strong functioning immune system, it is certainly an essential micronutrient for body, for cell repair and for building body blocks, but it is not an immune booster, so to speak. Similarly, neither is vitamin C.
Yes.
But these are all kind of vitamins and minerals that we need to hopefully take in good amounts in our diet to maintain normal functioning of our immune systems.
I think there's misunderstandings about functionality when it comes to certain things. Okay, so jumping off that, I want to speak to you about rashes in kids. What are the causes and symptoms, and how can they be managed? Especially, I think, for a new parent is when to seek help and go, okay, this is actually something a bit more serious than maybe, say, a heat rash or something.
So it's quite a difficult question to answer in 1 minute.
It is difficult.
Just because there's rashes and rashes. I actually did a really nice series on this with Prof. Carol Schleller, who is the head of dermatology, the past head of dermatology at Red Cross Children's Hospital. We did a whole series on what the rash and when to worry and what rashes to be concerned about. Okay. I think if I had to summarize it, a rash with a fever is usually an infection or a viral exanthem, and that may fall into the category of measles, German measles, roseola, a whole range of viral induced rashes. And usually you don't have to panic about those. Some of them are more contagious than others. Some of them need to be watched and treated more carefully than others. But essentially those are the kind of viruses, the rashes, where you can support your child, give antipyretics like paracetamol and ibuprofen, keep them comfortable, make sure that they don't dehydrate, and watch and wait. And those rashes usually kind of come in a big flare. They have typical ways of presenting, some what we call cephalorhodily. Some start on the trunks, some start behind the ears, and there are some clues. For example, measles also gives you spots in your mouth, and you often get a blocked nose. So there's some clues about which viruses are causing those rashes, but they usually pass. If there is a rash and a fever, it's usually infective, so keep your child at home at least until the rash passes or the fever passes, and check in with your healthcare provider about, how long to stay at home, especially around pregnant women or other young vulnerable families. Then obviously eczema and itchy rashes, and those have a totally different pathophysiology. Those are inflammatory conditions or allergic conditions, and those we don't cure, we just manage them ongoing by making sure that we keep the barrier of the skin intact, moisturized. Dry skin is itchier and flakier and at high risk for infection, and often we use steroids or kind of stronger medications to shut off the hyperreactivity reaction in our skin. And then there are obviously some serious rashes which we need to keep in mind, and those are the rashes, some of them may also present with a fever of, for example, meningococcal meningitis. And that's a very typical blanching kind of rash, and it's got a very typical look, and that usually occurs in a child who's also systemically unwell with a fever, photophobia, headache, vomiting, lethargy. And in that child, those are the rashes that you really need to take some seriously and address. It's really hard to summarize, but I think if you are not sure, that's what your pediatrician or your dermatologist or your GP is there for. And if you're unsure, sometimes very hard to tell over a WhatsApp picture, so best make an appointment with your healthcare provider, and they can take all the guesswork out of those difficult questions that keep you up at night.
Absolutely. Okay, let's unpack the necessity of dirt and messy play, because you brought that up already very briefly, how important it is, and I just want to break that down a bit more.
Sure. So I love messy play. I love dirty play for so many reasons. Firstly, children by definition are little explorers. That's how their brains gather information and learn the limitations of their own physical comfort zone, their own sensory comfort zone, their own psychological comfort zone. It is so important to allow children to be immersive in their play and engage with their surroundings. For me, the green belt after a good winter rain is one of my favorite outings for my children in Cape Town. They splash in the puddles, they eat the mud, and I'm certainly not advocating for picking up, food off the floor in the middle of a shopping center, but I think it's a wildly rich, whole body, neurological wonderland for growth and development. Hones sensory integration, fine motor skills, creativity, problem solving. And we know that exposure to some allergens prevents allergy risk later on in life. And it's also really good for emotional regulation, The children will find that point where, the mud in their mouth or their water up their nostrils is too much, and they will learn to self-regulate without us intervening in the most natural, explorative, inquisitive way.
I love that, yeah.
It's a key for building resilient brains.
Absolutely. It's one of the best. I always think nature is the key to so many. There's no downside to it, really.
Absolutely.
Let's chat about food challenges and picky eaters. Oh my goodness. What are the red flags, and how do we, I don't want to say force, but sort of work around this to encourage a little bit of openness?
So you're asking all the hard questions today.
It is, and I know, because I had one of these, and she only started transitioning into more food at about 3 years old, so it was quite a long, and even then, just 2 more things were added to the diet.
I think this is something that really stresses moms out. It stresses moms out, new moms, where they're starting the introduction of solids. Yeah. It's always such a stressful, am I doing it right? Am I doing it wrong? When do I introduce peanuts? How much is too much? Should I mix it with breast milk? Should I mix it with water?
Yeah.
I think, really and truly, if we just follow simple guidelines, I don't think you can do any harm. And that is a guiding principle through medicine in general, is that first do no harm. And for food, let's just start at the beginning with early introduction. I like a combination of purees, just because you're able to expose a child to various tastes and a whole range of nutrients in a pureed form. And baby-led weaning, because we know that it's stimulates autonomy. It helps with satiety cues. When they're full, they can stop putting things in their mouth, and also obviously hand-eye coordination. And it's also good for children to learn very early on that food comes in various shapes and forms. It's not just a mush out of a squishy bottle. It looks like an apple, it looks like a piece of meat, it looks like a little bit of scrambled egg. So I think variety early on is very, very important. Solids and foods and a stepwise approach. There's so much evidence for early introduction of allergens now, and that includes eggs, peanuts, whole nuts, tree nuts, fish, shellfish. And so we're introducing these earlier and earlier. And we're also not only giving babies rice porridge or bland foods, because we know that now that predisposes for a bland palate. So we want to add things like nutmeg or cinnamon or cloves, because we want to stimulate, or prime rather, those taste buds for a variety of sensual flavors, salty, sweet, bitter, a whole range. And we know that early introduction to tastes and textures may prevent pickier eating going forward. Picky eating in the later years may just be a matter of preference or a matter of what's predictable and what's, a little brain can cope with at that point in time, but it also may be there may also be an underlying cause. Maybe a sensory aversion, there may be a swallow issue, and so it may be a bulbar or a pseudobulbar issue where textures or bigger chunks of food are more difficult to handle. And remember that it's a big learning curve to learn to chew, move food around your mouth safely, breathe at the same time, stimulate a gag reflex, and swallow. And there's also so much pressure around meal times. And I think if that is the one thing that we can eliminate, I think feeding in general and diet would be a much easier place to navigate. Especially today with, having to have a tick box of everything and plates needing to be perfectly beautiful. Children really do self-regulate. They have something called interoception, which we as parents often take away from them by saying, oh, just 3 more spoons, or you can have your ice cream after you've finished your broccoli. And we know now that intuitive eating is a much more sustainable and healthier developmental process around food. Later on, often teenagers or older children use food as emotional regulation or control issues, and often that's a really difficult thing to unpack or to change. But I think the single message is that we never want children to lose weight. As long as they're gaining weight, they're growing, they aren't having recurrent infections, and we can alleviate mealtime anxiety and continue to offer children a wide range of food. I think we would do well to foster food neutrality in our homes and hopefully, alleviate some of the stress and anxiety around picky eaters.
Absolutely. I wish I'd done everything you'd said, because it was such, looking back, I made so many mistakes, and literally everything you've mentioned now was exactly what I should have implemented at the time. Okay, great. So tell us about the importance of fun, dressing up, creativity. What role does this play? Because a lot of kids these days are sitting in front of the TV or indoors or gaming or whatever the case is, and all of this seems to be falling away, and it's such a pity. So what is your opinion on how important it is?
So again, like messy play or outdoor play, imaginative play is really neurodevelopmental gold. When children dress up and pretend, they practice, again, emotional regulation, problem solving, perspective taking. It develops a theory of mind by understanding what would it be like, what is the other person's experience of the world. I'm the mommy, you the baby, and then you're the mommy, I'm the baby. So it helps perspectives, it helps seeing the world from other people's points of view. It helps fostering relationships and communication and language expansion, and really allows children to push the boundaries of their logical thinking brain into that realm of imagination and expansiveness and creativity. And remember that creativity wires executive functioning. Fun is not frivolous, it's developmental work, and play is where the magic happens. We always have to think, when we put children in front of the TV or gaming, whilst that in itself may not be the biggest poison, we have to think about what they're not doing when they're sitting in front of the TV. And what they're not doing is they're not sleeping. they're not talking to each other, they're not playing outside, they're not moving their bodies, they're not using their imaginations, they aren't problem solving. And I think that is one of the best ways to look at it, is not so much on the negative effect of what half an hour or 2 hours of YouTube are, but what are you taking away from your child by allowing them to choose that over a whole range of much more beneficial exercises.
Absolutely. Okay, great. So in your opinion, as a mom and a ped, what's a non-negotiable that a child needs to thrive and flourish?
So this is again a real hard one. I think psychological safety. I think consistency and psychological predictability, those form the boundaries and the guardrails for neurodevelopment. Children, what we hope to do is keep children in a regulated zone, because it's only in a safe, comfortable, regulated zone that we can lay down new memories, that we can explore the boundaries of our own comfort zones if we're in a safe and comfortable environment. And that is such a charged thing today, both in the context of a world which is not always safe and not always peaceful for children, and in the context of a really pressurized home environment where parents are stressed and pushed to the limits of their own psychological safeties and their own psychological boundaries. But the good news is that no, perfect is actually the not ideal. It's the not ideal situation for growth and development. What's so important for thriving is the flexibility of disrepair and then repair. How we handle difficulties, loss, change. There's a really lovely word which I've forgotten, but it's about how resilient children are in Scandinavian countries or at the extremes of the poles, where there's intense weather and there's a lack of weather predictability. So an outing to, outdoors is changed at the last minute by a big storm. And the ability for children to be flexible and change and problem solve adapt, that's the word, thank you. Because life isn't perfect, actually sets the stage for adaptability and problem solving later on in life. And so for thriving, I think just consistency, showing up, some form of regulation where there's the normal range of emotions, but when things go pear-shaped, how we repair is important, and how to model connection before correction. And that really is the soil in which everything grows. It doesn't have to be perfect. It needs the rain. It needs the storms. It needs...
Makes sense.
Acidity. It really isn't a perfectly curated environment. It's just a healthy mixture of good enough.
Yes. Okay, fantastic. Are there any upcoming events or workshops or collabs that you're going to be working on in the next 3 months?
Yeah, so it's really exciting. We are doing a lot of school talks around the CBD on many of the topics that you've just brought up. What does neurodiversity look like in the classroom? And if I'm able to get any of those recordings, I'm more than happy to share them with you and your followers. Food and eating is another talk that we're doing with a dietitian called Elian Horwitz. She also works in the CBD, and she's so brilliant at intuitive eating for families and how to make changes for the whole family so that we don't pick out a member of the family and pathologize food and eating. Good news is that my practice has now the proud receipt of an ADOS kit. And an ADOS kit is the global gold standard for diagnosing autism. It's not necessary and it's not essential, but in the US and the UK, this is the gold standard of diagnosis. And we have just imported that from the USA from 1st of April. We will be taking bookings for those families or those kind of grey cases where a diagnosis of autism but difficult, and then we rely on an ADOS assessment to help us formalize the diagnosis, and that can be very containing for some families who've been, in the grey for a long time.
I can imagine.
Yeah, that's really tricky. In Hout Bay, towards the end of March, we are running a play workshop for parents, because one of the things we really don't know how to do well is to play with our children. And this is at a little store called Rome in Hout Bay, and we're having a Saturday morning talk on how to play with your children and all the benefits of play. So yeah, we have quite a lot going on in the next little while. But look forward to keeping you informed.
Perfect. And contact details if someone wants to contact you. Obviously, Instagram is a great way.
Sure, we have a website called drraphaela.com. I did that because my surname is really difficult, so we left that out of the URL. My Instagram is Dr Raphaela Itzikowitz, and we have a WhatsApp line and a phone line, and otherwise just please feel free to email us or WhatsApp us with any questions at reception@drraphaela. And we're based in Cape Town CBD, in and amongst all the schools, so close to a lot of nursery schools, primary schools and high schools. And also I am part of the team at the Cape Town Therapy Hub in Greenpoint, which is a multidisciplinary team of OTs and speech therapists and educational psychologists and child psychologists, dietitians, the works, and you can also find us there.
Thank you so much for joining us today.
Thank you, Kat. Thank you so much. These are really hard questions, and thank you for stimulating the dialogue and offering support to your followers and your moms. I think it's amazing that we're starting to have these conversations. So thanks for getting to the nugget of it and having these conversations. And thanks for having me.